And let's go ahead and get started. I'm going to turn the virtual stage over to Ashley, all about the Counseling Center. Thank you.
Thank you, Summer. Hi, everyone. Welcome. Thank you for joining us today. To introduce myself, my name is Dr. Ashley Wolfgang. I'm a licensed psychologist, and I'm also the Associate Director of Clinical Services at the UCC. And right now, I'm also serving in the role of our Interim Executive Director. And I'm going to allow my colleague Bernadette to introduce herself as well.
Thank you, Ashley. Hi, everyone. Like Ashley said, my name is Bernadette. I use she, her pronouns, and I serve as the Associate Director of Outreach at the Counseling Center. I am a licensed professional counselor here in the state of Pennsylvania, and I'm really glad you all are here to join us today. We are going to do our best to do an overview of what the Counseling Center offers for students. We have built some built-in times for you all to ask some questions. So please, as we go through, if a question comes up, please utilize the Q&A feature. We will pause throughout to answer those as we go.
All right. So we are here primarily to support the mental health and the emotional well-being of our students. We provide a wide range of services. We probably won't have a chance to talk about all of them today, but we'll definitely give you an overview of the main things that we offer. Um, our services include both clinical services, so the traditional things you think about, like individual therapy and group therapy, but we also do a lot of outreach, workshops. We guide students towards self-help. So again, a full range of services for students. One of the great things about our center is that we do not bill insurance. We are very thankful for that, and I think students are very thankful for that. That's one less barrier or hassle that they have to think about. Our services are free, included in tuition as the wellness fee. There's only one service that comes with a cost, and that is psychological assessment. And even psychological assessment is much more affordable than it would be in the community. But beyond that, all of our services are free and insurance is not needed. We offer our services both in person or virtually, whatever fits a student best. They can do it from the comfort or their own room. And we know a lot of students prefer to sit directly across from a person, and we can accommodate both. We have a pretty large staff, and another cool thing about our center is that we have a multidisciplinary staff. So we have psychologists like myself, professional counselors like Bernadette. We also have social workers, licensed marriage and family therapists. And then we are also a training center. So we have a number of advanced graduate trainees at our center as well. Um, all of our services are confidential for students, except when we have written consent or when we are required to by law. And I'll talk a little bit more about that on our next slide. So we follow all HIPAA and FERPA standards in terms of keeping your students' privacy and confidentiality. I know sometimes that's hard. Most parents have probably been pretty involved in their students' healthcare and clinical care up to this point. So if a student is 18, and even if under 18, they are entitled to confidentiality. So basically, we cannot share details about your student's treatment or even schedule with you without them being present, without their written permission. However, that doesn't mean we can never share information with you. Lots of students will sign what we call a release of information. You might be familiar with that through your own healthcare and medical visits. They can complete that for the parent, whoever they'd like us to share their information with. Some students, we encourage to sign a release of information for previous therapists that they've worked with. So we have an idea of what their treatment history has looked like. And in that case, we were able to share some information with you and coordinate with you if that makes sense. We also might break confidentiality if we believe a student is at imminent risk of danger, either to themselves or posing a threat to someone else. In that situation, we will do everything we can to keep the students safe or the community safe. And then finally, if we have any concerns about child abuse or elder abuse that is disclosed to us as mandated reporters, that is something that we would report as well.
I'm going to talk for a second here about our scope of service. We serve all of our students, and so you can imagine that there are a lot of diverse needs that students are having. And so to make sure that we are able to connect them to the most relevant and appropriate supports and resources, we use something called the personalized care model. And it's really kind of a multi-level approach that really focuses on what someone might need and how we can support them in their care. We're really aiming to make sure that students have access to care. One of the ways that we do that is we have this really wide range of services and programs like Ashley spoke to. And we're actually going to break those down even further for you so you have a really good idea of what we provide. So there's a lot of different entry points for students. There's a lot of ways for them to receive the type of support that they might need. We really look at students' strengths and resources that they already have and how we can leverage those and utilize those so that students, again, are getting that really well-rounded support. And we're also looking to increase students' resilience and their overall wellness by connecting them to those different types of supports. Typically, in order to support this model, we are offering short-term clinical care, and we really connect that or use those community-based programs like our outreach programs to supplement some of that clinical care and make sure that students have access to support throughout their entire year, but also their entire time while they're at Pitt. And just to share a little bit more in terms of scope of service, some of the things that we don't do. We do not offer psychiatry services at the University Counseling Center. That is a service that students can access through our student health services. Both of our main offices are located in the Wellness Center in Nordenberg Hall, and we work really closely with them. But if they are looking for psychiatry services, you do want to encourage them to go to student health. We also do not offer any type of court-ordered evaluations, fitness for duty evaluations, or any type of documentation for emotional support animals. Really, any type of mandated treatment, we do not provide that. All the care that we provide is voluntary in nature, meaning the individual, the student, does have to opt into that care. We also do not provide documentation to support any type of academic accommodation, withdrawal from classes, or grade adjustments to new students or to new clients. Typically, we want to be working with somebody for a period of time so that we are able to share information that would feel relevant. If we are providing that type of documentation, that type of support. If we've just met somebody for the first time, we're not typically able to provide that type of information or information that would be helpful in general. So typically we want to have a relationship with folks before we do that. Something else to keep in mind, because we do operate within the university system, there are going to be times where there is a disruption to care for students throughout the calendar year. So I'm actually going to bump down to the second bullet point here. So we follow the university calendar, and we do close during winter recess. And so for some students, that means that there is going to be a slight disruption to their care because our entire office will be closed, I think for about 10 or 12 days between December and January. So something to think about. The other way that care could be disrupted is if a student is traveling outside of the state of Pennsylvania. Typically for most of our students, they are here in Pittsburgh, and so there's no problem with doing in-person or virtual care. But all of our clinicians are licensed in the state of Pennsylvania. What that means is the second that someone crosses over that state line, we are no longer able to provide them any type of clinical care. So you can imagine touring times like this summer, where students are maybe traveling back home or over spring break, winter recess, things like that. Sometimes the care can be disrupted for that reason. Our clinicians do a really fantastic job of preparing students for those breaks, preparing them to consider other resources, and really plan ahead so that it doesn't kind of jump up and surprise anyone. So it is something that we really work to address throughout the year, but just something for you all to recognize as well. Okay, so this is one of those pauses that we are going to take. I have not yet looked to see if there's any Q or A, but this is an opportunity. If there's anything that you have question-wise so far, we'll give it a second for folks to type. If not, we'll continue on and we'll circle back at the end. Okay, so if you are typing, please keep typing. Like I said, we'll come back to questions at the end, but we are going to keep going. All right, so like I said, we're going to try to give you an overview of the different services that we provide. We tend to think about these in different buckets, so to speak. So we have our well-being programs and services. These are really programs and different things that we offer that are out in the community. The focus is really meeting students where they are. We also have our clinical services, and students can access a lot of these different types of services. Ashley's going to speak to those here in a bit. And then, of course, we have our crisis services. These are services that are available 24/7 to support our students on campus, and we will dig into those a little bit more as well. So I'm going to start by talking about our well-being programs and services. So you see we have a couple different here. I'm going to share a little bit about what they are, and then I'll give you kind of the way to get connected, the way students can learn about these and get connected. So the first service we have is something called Togetherall. Togetherall is a completely free and anonymous online community that is peer-to-peer support. And this is specifically for mental health concerns. So they have discussion boards, there's different psychoeducation learning opportunities for students to engage with. The best part about this is that it is monitored 24/7 by trained clinicians. So they have mental health staff who are monitoring the discussion boards, different scales that people take while they're in this, while they're on the website. They're monitoring those, and they will reach out to students if additional support is needed. Particularly around safety concerns. So this is something that students can access at any time, any place. This is not limited by, a university academic calendar or location. They can get on this at any point in time. We also offer something called Ask a Therapist. So these are really informal but confidential consultations with one of our staff. These typically look like 10 or 15-minute conversations where someone may have a question. Maybe it's about our services. Maybe they're having an issue with a roommate and they're not really sure what their resources are. This is really an opportunity for students to say, hey, I have a question. I don't know that I want therapy, but I want to talk with somebody to get a little bit of support. This is a great way for students to kind of start that process or even dip their toe into what therapy might look like and learn a little bit more about what is available to them. Ask a Therapist is offered both virtually and in person. Again, we want to make sure that we're able to accommodate where different folks are. We offer them during the day, in the evening, in different locations on campus. We also have different workshops and events. So we really try to make these interactive spaces where our focus is increasing awareness and skill building. So some of that psychoeducation, we're thinking about mindfulness or distress tolerance skills, coping strategies, things like that. And there's typically always an interactive component to that so that students are really able to practice in the moment with us. We have peer support spaces. These are really, we open these up for students to create new relationships, particularly for first-year students. They are building those relationships. They're building a brand new support network here on campus. So we really want to create spaces for them to access that, have some space to, connect where they don't necessarily have to approach somebody kind of cold call, so to speak. And there's a lot of space for discussion around different concerns that folks are having. And those are typically offered, they're weekly, bi-weekly, and monthly. So they're kind of all over the place for students to get connected. And then last but not least, we offer outreach requests. So faculty departments, so professors will often reach out to us to have us come speak to a class. Student organizations will often reach out and say, hey, can you come talk to our members about test anxiety or stress management? And we're able to go out and provide different presentations, engage in different panel discussions, and talk about a lot of different mental health topics, and interact with students and really get a gauge on what's going on with them and how we can be supportive. So there's a lot of different ways for students to learn about what we have going on out in the community and connect with us. Of course, we have our website. It's really great and easy to remember, counseling.pitt.edu. You can find out, actually, everybody can go and find out more about our resources, all the different services that we offer, but they can, do a bit more of a deep dive. We're also on Instagram, so we're at pitt.ucc. We will do a lot of announcements around the events that we have, ways that students can get signed up for events. Experience Pitt is also a great venue to do that. Experience Pitt is not just the counseling center, it's all over campus. So this is a really amazing resource for students to find out not just about us, but all of the different campus, events and resources and things that are taking place on campus, and they can sign up that way. There's also our events calendar, just yet another really big space website where students can find about all these different types of events and resources that they have access to. And then last, but certainly not least, we are part of the Student Affairs Division. And so a lot of information about our services and events and workshops will be sent to students in a bi-weekly newsletter that goes out. So they'll have some of that information sent to them, and they won't necessarily have to go looking for it if they're not able to. We know they're really busy. They've got a lot going on. And so that's another great way to get connected.
So before I talk about clinical services, I wanted to go back to a question that I answered in the Q&A. Someone had asked again about how students or where students can access psychiatric services. So Pitt does offer psychiatric services, but our psychiatric providers are housed within student health services, as opposed to being housed within the University Counseling Center. So if students are looking for medication management, they would just need to get in contact with student health. If they come to us first, looking for medications, that's totally okay. We'll help them get to where they need to go. And we can also provide referrals to the community if that's a preference as well. So just wanted to address that so everybody could hear the question. So clinical services. So these are services that students will become a client of the center to access. So again, we offer a number of different clinical services, individual therapy being one of them. As Bernadette talked about earlier, the frequency and how long a student is in treatment is based on that personalized care plan, given what they're presenting with, history of treatment, safety. All of those things will determine that duration and frequency. And again, it's individualized to each student. There are no specific session limits. I think sometimes folks get confused about that because there are a lot of other universities that have session limits. We do not have a session limit. Again, it's an individualized plan. We also offer a number of therapy groups. These are a little bit different than our workshops in that a student has to become a client of the center to access a group, and it is based on therapeutic skills or therapeutic support. So to give you an example of some of the groups that we offer regularly, we have an anxiety support group. That is one of our most popular groups. Lots of folks come to the center with anxiety concerns. We offer a grief support group for students who have experienced a significant loss of some kind. We have an international student support group for our international students. We have a trauma psychoed group for folks to learn about symptoms and how to manage traumatic experiences. We have a emotion management group, which helps folks to learn emotion regulation skills. And I think another popular one is called our Making Friends with Yourself group, and that's based on building self-compassion. And we offer new groups each semester based on feedback we're hearing from students, what's going on in the world. And so, as Bernadette mentioned, checking out our website, looking at our Instagram is probably a good way to figure out what groups are being offered. And then, of course, our clinicians who are meeting with the student might suggest certain groups that seem to capture their presenting concerns well. Sometimes students come to us looking for specialized services or maybe longer term care that we don't necessarily offer. And in that case, we will work with them to connect to off-campus resources or maybe another department on campus that can meet their needs, whether it's financial, well-being office, or our care and resource support team. To address maybe things like basic needs, food insecurity, things like that. We have a really lovely database called Thriving Campus. Essentially, it's a database of community providers in this area, as well as different places in the country. So as Bern mentioned, if a student is traveling home for the summer and that is not in PA, we can use that database to look for providers that may be in their area that they can access in the meantime. We do offer substance use services. We have a collegiate recovery program. And then, as I mentioned, we also do offer psychological assessment or psych testing for ADHD. So it's really easy for students to access our services. I often say, if you remember anything, remember drop-in hours. We offer drop-in hours Monday through Friday, 9 to 4. Students do not need an appointment. Usually what we tell students is if you have an hour or two, if you have a break in your schedule, drop by our center during those hours. And the first available clinician will meet with the student to assess their needs, assess their concerns, and then make some recommendations based on the information that they gather. And that's how students can get connected to any one of those services that I just talked about. Students can also come to drop-in hours if they're experiencing a crisis or urgent concern. So if they're not necessarily looking for ongoing services, but there's something really critical going on or something that needs, quick attention, we can do that as well. I'll talk a little bit more about our crisis services in a moment. It's a pretty quick process. Our paperwork prior to starting that drop-in appointment takes about 5 to 10 minutes to complete. That helps the clinician to get a sense of what they're coming in with and what resources they might have. And again, like most of our other services, we can do that drop-in appointment in person, or we can do it virtually if that makes more sense for the student. So just to give you a sense of what students commonly present with at the UCC, like I mentioned earlier, a lot of students come to us with anxiety or depression, or just maybe a shift in mood that they're noticing, and they want to determine, okay, how do I manage this, or what is this? Interpersonal concerns are very common. Especially if you are moving in with a roommate that you don't know and you're navigating the rules and the boundaries of that relationship, or maybe you've moved in with a high school classmate and you're not used to being together for that many hours a day. Starting new romantic relationships, very common to present with interpersonal concerns. Self-esteem concerns are common. Just the general transition to college can be hard, being away from home. There's a lot less structure in college than there likely was in high school. And another thing that we see a lot is most students at Pitt are used to being at the top of their class, and now they are with a whole group of people who are at the top of their class. So sometimes it can feel a little bit intimidating or competitive, and so we work with students to manage those feelings. This is also an age when students are exploring their identity, and so that's another common concern that we can assist with. Some students are very focused on a specific major and a career trajectory, and they feel a lot of pressure around that. And other students come here and they have no idea what they want to do, and they're feeling pressure around that and having to come up with decisions. So absolutely, we can assist with that, maybe even make a referral over to the Career Center. And then just stress in general. It's stressful to be a human right now, and certainly stressful to be a college student. And again, we don't turn any student away who comes to those drop-in hours. We do a full assessment to consider what level of care, what type of care might make sense. All right, and then I mentioned we do have crisis services and crisis support. So students can actually call the center 24/7, even after our doors close, on holidays, on weekends, during that winter recess that Bernadette talked about. We do have licensed clinicians available by phone. To support a student, again, 24/7. So usually what I tell students is even if we're not open and it's 3 a.m., please still call us. There's somebody there to support you. Your mental health concerns may not align with our business hours, so we don't want students to have to wait to get support. We encourage them to call. And then, of course, if we are open during the hours that a student needs support, they can certainly come to those drop-in hours. Also very proud to have a higher education assessment and response team, or a HEART team. We were one of the first few universities within the country to have a co-response program. So what that means is that we have crisis clinicians who co-respond with Pitt Police to welfare checks or crisis situations or tragedies that might occur on campus. Again, alongside our public safety folks to support students. You may have seen this, in your own hometowns or your own cities, where social workers are starting to respond alongside police to support individuals when the concern is not criminal, but it's more of a mental health concern. And so we follow that same pattern. And in this way, students are able to interact with clinicians first if it's safe. Our goal is to connect them to resources sooner, get them connected to the UCC, avoid unnecessary hospitalizations. It's been very successful so far. I think we started that in 2021 and it's going strong. If you have a concern about your student, about your child, you're not able to reach them, or they've expressed some or said some things that are concerning, either on the phone or text message, you can initiate a welfare check by calling our Pitt Police. The number's on the screen there, 412-624-2121. Again, if Heart is on duty, they will respond alongside Pitt Police if you have a concern about their safety.
Okay. We also wanted to just take a moment to speak a little bit about the community resources that we have available to us, that students can utilize. Sometimes students don't want to come to the counseling center for various reasons, and that's okay. I think Ashley had mentioned Thriving Campus. This is really an online directory of off-campus providers that students can utilize. Really, anybody can use this website. You can do a search. It is initially set to the zip code around our campus, but you can change that, and folks can use this for any location. It's very easy to use. It's very user friendly. There's the filter system. So if you've ever looked for, a very specific type of, I don't know, black short sleeve t-shirt online, and you've used the filter system to make it so that's all you're seeing, this is very similar. You can click certain insurances, different concerns that providers are comfortable treating. So there's a lot of different resources on there. We are very fortunate that even within the community, just in the surrounding areas, there are so many different providers. In Oakland, Shady Side, Squirrel Hill, these are all kind of areas that are very close by. And so there's a lot of resources available, and the website is there if you want to jot that down and take a look at it. We also are really fortunate that we have UPMC's Western Psychiatric Hospital basically on our campus. It is is in between the new Wellness and Recreation Center and the Peterson Event Center. So it's very central on campus. And they provide 24/7 support for mental health concerns. They provide that emergency care. They also have inpatient treatment. They additionally do have some facilities both in the hospital and in Oakland that provide outpatient care as well. We interface and connect with them frequently to make sure that students are receiving the appropriate level of care, and that they're getting supported if they are transitioning through different levels of care. We also have something called Resolve Crisis Center. This is a joint effort between Allegheny County and UPMC, where they provide 24/7 crisis support to Allegheny County residents. As students living in Oakland, your students are considered Allegheny County residents at that time. They have a 24/7 hotline that students can call. They have a walk-in center, so students can walk in to get care in person 24/7. It's located about 4 miles from our campus. They also have mobile crisis teams that are similar to our Heart team, where they can go out and meet with individuals in the community, in the county, and provide them support in the moment. They can also do transportation if they're needing to connect with a higher level of care. You can also see their phone number there as well. So just wanted to pull together all of our information. So if you wanted to jot this down, the QR code there will take you to our website as well if you want to just look over that. We are located in the Nordenberg Hall. So we are very close to something called the Soldiers and Sailors Memorial. So once students know where that is, they will be able to find us quite quickly. We are on the second floor, and we do share a suite with Student Health Services. We also do have offices in the new Recreation and Wellness Center as well. You'll see our phone number there and our website alongside our Instagram, and just a quick reminder of our drop-in hours. So I'm actually going to leave this up here for a second while we check out the Q&A. Ashley, we have a question. Can we provide more detail about services the UCC would provide for individual therapy versus what would be considered long-term care?
Yeah, I can answer that one. So I would say the most common duration of treatment is probably about a semester or two, um, at the frequency of weekly to every other week. Obviously, this can vary depending on a student's needs. Sometimes it's a lot shorter. Some folks may only need one session. They come in, they talk about a very specific concern, and they're good to go. And other folks have something that might be a little bit more complex that needs some time. Um, some students want to be able to connect with somebody throughout their time here at the university. And so a lot of times in that case, we'll help them connect with a community provider that can be their consistent source of support throughout the entirety of their time here. Um, all of our clinicians are trained as generalists. So, like I mentioned, we can treat a variety of mental health concerns. And then we also have some folks on staff who specialize in various mental health concerns. So, both Bern and I sit on the eating disorder treatment team. And then we also have folks who specialize in substance use, trauma, grief. And so, if a student comes in with a specific concern that would benefit from one of our specialist clinicians, we definitely do our best to connect them with that clinician as well. So again, I think my best answer for that is it's very individualized. We consider the whole picture. We consider a student's resources, the complexity of the student's concerns, and kind of go from there to match them up with what makes the most sense.
Thank you, Ashley.
Mhm.
So any other questions that we can answer?
I see a heart. Thank you for
Yeah,
the
I
heart.
appreciate that. Oh,
Well,
you're
if
welcome.
and if you think of any, additional questions, you can always call into the UCC.
I
Um,
will actually go back so that you all have
yeah,
that information.
yeah, we are used to calls from parents around this time of the year as you start thinking about things or encouraging, your student to access our services. And yeah, if there's anything that you have questions about, please call us.
Thank you both so much.
Of course.
So you got
Yeah.
hearts and claps. I am going to stop the recording, but as a reminder, all of our Pitt Family webinars are on the Student Affairs YouTube, Pitt Student Affairs YouTube channel. Just Google that like phrase, Pitt Student Affairs YouTube. Our channel will pop up. There's a playlist for Pitt Family webinars. This one should be on in just a day or two. Sometimes it takes us about a day or two to get them up. That's late.